Well, good evening, everyone. This is Tim Ashe, President of the Vermont State Senate, here with my daily update on Vermont's experience combating the COVID-19 pandemic. And I'm really excited to be discussing one aspect of the state's challenges dealing with COVID-19 and making sure we're meeting people's needs, and speaking with three professionals who are really in the trenches, facing the most acute aspects of something we've all been feeling over the last 10 or 11 weeks over the course of this crisis. So we're going to be talking with three people who work at Washington County Mental Health Services, which is Central Vermont's agency that addresses mental health needs and also substance abuse disorder challenges that many Vermonters face in that neck of the woods. So we have Mona Karia, who's works at Single Steps, and I will let her explain in a second what that means. We have Jackie Jones, who runs the Urgent Care Program, and I'll let Jackie fill you in on what that means. And then we've got the boss, Mary Moulton, who can speak more globally to what the organization has really been facing under these really trying times. So thanks all three of you for taking some time.
Thanks, Tim.
So Mona, I'd like to begin with you. So Single Steps, to someone who's, not a client or, deeply versed in Washington County mental health's organizational structure won't come away knowing exactly what that means. So can you say a little bit about what Single Steps is, what the programming and clients are like under normal circumstances, meaning pre-pandemic, and then maybe offer some reflections on how things have been affected over these last 10 weeks.
Absolutely. Tim, first of all, thank you so much for inviting me to this. It's really important information to share with the general public. So Single Steps is a community-based residential home in Montpelier, serving the community support program, clients who are in the community support program, also known in the state as CRT program. We serve adults with persistent mental illness and co-occurring issues. We are a transitional, so that means that folks are there anywhere from 6 months to a couple of years. And the goal is always to transition to more of an independent setting and community-based. We really want people to get back into the community that they're from and they're living in. So that's a little bit about Single Steps. We're staffed 24/7. We have a nurse that's there about 20 hours a week. We provide oversight, medical oversight, and also any kind of transitional oversight, acts of daily living, employment, etc.
How many people would be living there at any moment in time? Is there an age range which is typical?
So it's 18 plus, and there's up to 8 people at a time. Okay. And as I said, we're staffed 24/7, so there's always a staff person there, and myself being on call 24/7 for any kind of support that comes up.
So how would people who have persistent mental illness, obviously that doesn't mean the same thing for every person that you're serving at Single Steps. But as someone who's not in the profession, makes me think that there are challenges that are already being confronted and supported by the people who work at Single Steps. And I might be naive to think that COVID-19 would add additional stressors on some of the people that you serve. Would that be a true assumption? And if so, how does that manifest itself on a daily basis?
Yeah, great questions. So, early March, we started getting emails from the state. We started getting emails from Washington County. Everybody was talking about COVID-19. We're talking about prevention, contingency plans, preparation, response, etc. And there was a challenge of how do you run a community-based group home while practicing social distancing, while working with residents who may not recognize the need to change their behaviors or wear personal protective equipment and or maintain social safe distancing. And we weren't thinking let's close the group home down, but we were thinking how do we evolve to accept this change that is coming, that is here. It is real. It is something we need to deal with. And what do we do and how do we keep up with all these changes? Residents, we did have some residents who, with their previous trauma experiences, wearing a mask just wasn't an option for them. And staff coming into the group home wearing masks was, could have been re-traumatizing. So trying to figure out how do we honor all the different things that are being asked of us as people who are providing service and honor the people that we're serving. And it was really a lot of balancing acts. We've really been lucky. Our agency has been so responsive with education, with providing support, with patients on how to help residents in the group home keep continuing their daily lives with COVID-19 being present within their community.
Well, I'm going to chalk it up to not being lucky, but maybe being very good.
I think it's a combination of all.
Yeah. No, I know that facilities, whether they're in Vermont or around the country, that have had the first person who is infected with COVID-19 and then it spreads. It's not always because the facility has made some colossal blunder. Sometimes it's the misfortune of someone left the building and came back, and there's not much that the staff could do about it. But I think that you've highlighted that for individuals for whom various traumas mean that there are comfort zones and routines, that the moment you disrupt that, it really creates the opportunity for some real setbacks in people's treatment plans and so on. So the fact that you've been able to be flexible, I think, is probably a testament to the work you guys do more than anything, hopefully.
For example, we, the residents at Single Steps, one of the things they do, part of independent living, is each person cooks one meal a week for everybody else, and they get money, they go to the grocery store, they come back, they cook a meal for everyone else, clean up, etc. So when we started restricting some of the safe distancing, going to the grocery store was not an option anymore. One of the other group homes decided that staff was doing all the cooking, that the residents were no longer going to engage. And for myself, it was trying to balance having some consistency in people's lives, because it is so important with all these changes going on to just not completely uproot your daily life, to have something there that, this is happening every day for me. So we ended up doing the grocery shopping, but residents still got to cook. They still were able to participate in that.
No, that's great.
Yeah.
So Jackie, you're at the urgent care program. Tell us a little bit about how what exactly that means, which type of clients you're serving, and then same thing, how if at all has the COVID pandemic impacted either the staff or the individuals you serve?
It's impacted it quite a bit. At first, there was quite an ebb. The program is community-based, so we have about 4 master level clinicians that go out into the community and meet with whatever the need is. So we have our 24/7 screeners in our system, and oftentimes they will refer to adult access, who will pick up the client and kind of work as a hub, or like I often say, it's a rotary, and try to find the right exit for a client to go to for long-term care. So we can see anything from somebody that's struggling with maybe relationship issues, or somebody might have some psychosis, all different types of level of need. But through COVID at first, because everybody was at stay at home, it was not seeing a lot of action at all. People just kind of stopped having problems, but they really didn't.
Right.
And so I think from having the stay at home order, a lot of things amped up for people. For some people, it got better. They had time with their families and they were able to kind of have a moment of time and be able to sit back and relax maybe. But more often, I think people lost their jobs. They were at home doing homeschooling with their kids. And so a lot of amping up. And so now I think what we're seeing is a kind of a surge, not in COVID, but surge in mental health issues that are coming up. And that's across the board. And so we also have just the people, the clinicians that are doing the work, often are working from home, doing via Zoom or phone calls, which is more stressful because it's much easier to meet with somebody in person. And I think people like to meet in person, and you can read the cues of a person better in person. And doing Zoom or phone calls can be stressful. However, for some clients, that's actually been easier, because for some clients, their problems might be, I can't leave the home because I'm so anxious. And so for the first time, they are connecting to a clinician via Zoom or phone call. So that has kind of worked in their favor. But overall, the emergency system is starting to see more people. More people are going to the ER for their whatever problems they might be having, or they're just starting to come out and people want to see people in person. So I think we're getting more phone calls, we're getting more referrals, and the need is higher now.
So oftentimes the stigma around mental health is that the people who have not been impacted themselves or had family members or friends often have an image in their minds of who is the type of person who might be seeking mental health services, and they have someone who, and I'm saying this not to represent this, but they have this caricature of a deranged person walking around who looks dangerous and impulsive, and what it sounds like you're describing really breaks that stigma entirely, that it's people from all walks of life, even income levels, jobless and with jobs, and everyone in between, with kids, without. Is that a fair assessment of the clients you see?
That's a very fair assessment. And I think I love that you're bringing that up, because that is often a problem. People don't seek out mental health help because they feel like that somehow means they're weak, and not at all. I see a therapist, I admit it, and it's very helpful. And I don't think people have to see somebody for the rest of their lives. They might need to see somebody for just maybe 6 sessions or something to get through a little problem that they're having. And oftentimes, like, COVID is bringing up anxiety and depression. And that's for people that can cope normally every day. And they might just need to talk to somebody for a brief period of time, and then they feel more normal. But there is no normal right now. So I think
you don't have to tell me that. In almost every regard of the work I do in the Senate, it's very we have the good fortune, all 30 members of the Senate are in good health, haven't been impacted by COVID-19. The work we do is largely work of the mind, right? It's we don't have to leave a building to do it, and yet trying to look at a screen with 29 other tiles and have the same kind of process of developing ideas has been completely, it would be untrue to say that it is the same as being in person. Now, I do have a question though. So in terms of using technology for appointments, you've raised the issue of those who may be reluctant to come out of their homes in the first place. This might actually be a very beneficial thing. Have the practitioners enjoyed using technology? If this was a permanent thing, do you think people would be less interested in even doing the work because it's, you've got this interface of a screen between you and the person that you're working with?
Well, what I'd like to see happen, and I think it will, and Mary can probably say it is or isn't going to happen, but that we'll have a hybrid. We can do some Zooming, and we can do some phone calls. It all depends on what's needed. I had one client that wasn't working and needed to come in and see somebody in person. And so, yeah, then I'm going to see you in person. Whatever's going to work best for that person in that situation.
Great. Well, I hope that one of the things we learned from all of this is how effective and when it's effective, and for which patients that it's effective to use technology, because for years we were trying to advance telehealth and telemedicine. And frankly, the insurance companies were the problem. They were just convinced that it could not be a high value proposition and drag their heels every step of the way. Obviously, they had to be very flexible back in mid-March. And hopefully there'll be some good case studies about how this has really fared out in the real world, so that when it's appropriate, we always use it. Same is true for physical health. There are obviously many consults which really don't have to happen in an office, and trying to figure out when it's appropriate to avoid the trip is really key. So Mary, Washington County Mental Health is a very large organization in central Vermont. And we've just heard about 2 of the programs, but there's many other services that are being offered.
Certainly are.
We don't have time to talk about all of them. Can you say a little bit about the sort of the total experience of Washington County Mental Health Services throughout all this, in terms of the impact on staff, the impact on the people you serve, financially, what this has meant? I don't think people understand that Washington County Mental Health doesn't, you don't have staff meetings where you throw cash in the air and it sort of rains down on you. And
Only counterfeit.
yeah, maybe monopoly money, but
Yeah.
What's been the overall impact on an organization that people often probably take for granted, but is holding together a major part of the social fabric?
So I think it's been kind of mind blowing, to tell you the truth, Tim. So, it seems like we went from, working on our regular programs and development and maintaining everybody to COVID-19 response, and that's just changed everything. So, isolation we worried about from the very beginning for people, because we knew, and we do know that it will have an impact ongoing for a while. I always say, if someone says, if you decide to take a vacation and you want to go out in the boonies and you just don't want to contact anybody and be by yourself, then it's wonderful. It's vacation. But if someone tells you to go do that, it plays a really different way in your mind. So the pandemic is in fact a disaster, and having myself been a disaster responder for years, there's a human response to disasters. And that brings us to the exact types of things that everybody here is talking about, from the lull that we experience now to people working together. And there's this honeymoon period where we're all, doing everything we can. And then we hit into a period of disillusionment. That's kind of where we are right now. So, for us, it was clients and also our own safety within all of our buildings. And we had people out delivering food. We set up a food site at our children's division so that we could go out and see families, just doing a drop off to get it eyes on and provide some support to those families that experience trauma. We did the same thing with our folks who have who need developmental services, people who have major mental illness that are living independently in their homes. We did the same thing. We had people going out, staying socially distant, bringing food. I cannot even imagine how many meals we've delivered, thousands, frankly. So it shifted things a great deal. And right now, we're seeing that increase coming back in to the emergency room. And we're just going to be, we went from the hospital saying, wow, what did you guys do? We haven't seen anybody. And, folks stayed home. And 2 weeks ago, we had 9 people in the ER waiting for hospital beds. So, we're absolutely seeing that. We expected it. That is the pace of a disaster response. And that's why mental health needs to be upheld. When we talk about what our financial needs are going forward, actually, we got to make sure we don't slip, because we're going to see people having a lot of needs along the lines of anxiety, depression, substance use disorders, the impact of losing jobs, having kids home, trying to do the best you can, but not having those normal school supports and social supports, et cetera.
What do you think that, knowing that, your organization in some ways, because of the particularly challenging work that many of your employees do, it's already a very high stress work environment for many of the positions, even if they love the work.
Yeah.
Many businesses, many nonprofits, government agencies, all in that first month and a half, it was like every day felt like a year, right? It was just cramming so much decision making and fast moving, flexible decision making in such a short period of time that it was almost so light speed that you couldn't even keep up with time. Time started to not feel quite the same. But now as you describe it, it's like there's the disillusionment. I've called it a malaise, this moment where you're like, how much longer will this go on? How much longer do I have to have my
COVID
choices?
fatigue. We call it COVID fatigue.
Well, yeah, and I even you mentioned those who I have introverted friends who sort of celebrate the choice of being introverted, and it turns out that when the choice was taken away, their introversion became like a prison cell. But how sustainable do you think this is from the workforce point of view? Like if you found out, if the Commissioner of Health said, you know what, we're on lockdown for the next year. I mean, just on a human level, how do you see the ability of the people who work for you to sustain the challenge of on the job, the normal on the job challenge, plus this weight that that we know you must feel with these extraordinary circumstances?
If we always need to know where our out is, right? I mean, it's important for us to know when we're locked in a box that we could see our way out. And so what I see is for every extension that happens, there's kind of this a range of emotions that people have. And that's from frustration to anger even, right? So I think if it was a year out, our staff is tired now. I think I'm seeing Jackie and Mona nod. Zoom is actually hard to do all the time. You asked that question. I think we're anxious to get back to regular work with people. We are gatherers. We like to hug. People like to touch each other, and we have to stay a distance. This is very hard. And if we have to do it for a long time, I think we will see great stress. Stress isn't a bad thing in our day-to-day lives. Distress is when we tip over. And that's what we're seeing with some folks now. So we have to really be, that's a really interesting question. And if that were to be that long, I think, we're meeting all the time to say, how do we help each other? Well, what can we do? And so I think it's getting outside now. It's saying, it's harder walking back than it was walking out. I can tell you that. So we're now having all the signage in our buildings around, if you come in, you have to take your temperature. You sign in, there are 4 people allowed in this conference room. You must wear masks. So we're doing all of that because we see the need to at least begin to allow some people back who want to come back. It's a balance. And our mental health is extremely important.
Well, I was asked recently whether I thought this experience would make people less likely to either run for re-election to the legislature or to seek office in the legislature. And I said that I think right now people are operating under the assumption that things will return more or less to normal maybe in January or February. And so it hasn't really had the effect of dissuading people from running. But if it was going to be 2 years of remote legislating, I think there'd be a huge disinterest felt across the board, because it is not the same as being there in person and experiencing the process of lawmaking, which in some ways is no different than other workplaces where you feed off one another. So we've only got a few more minutes. Mona, a question for you, and maybe this is a little more on the personal side, but do you think that there's going to be a moment where you kind of recognize that we've gone from the COVID moment at single steps to a post-COVID moment? Or is there just going to be like a slow tail of getting past it, and then there'll be some moment where without even knowing it, you're back to some new equilibrium?
That's such a great question. And the way I have been seeing this is it's so fluid. It's evolving and it's changing, and it's like a dance, you know, we're like at some point we're doing the samba and then we're doing a slow dance, you know, and so will there be a point? I don't know, you know, I don't know what to predict. I mean, just today in the news, I read that there's more COVID cases in Vermont. So as we loosen the spigot, we're not sure where it's gonna go. I feel that there is so much compassion with the people that we work with, that there has been an acceptance of this quote unquote new normal. So yeah, I'm not sure if I've answered your question or not.
No, you have, I think, and it's something that we're all going to be challenged to think about. I had been thinking like a month into this crisis, you know, and I was burning the midnight oil day after day after day. And I thought the moment, you know, there's going to be a moment when this is over and I'm going to collapse of exhaustion. And then I realized there actually isn't going to be like a moment.
Right.
Yeah.
And that was very depressing to think about, but it was also probably realistic. Jackie,
It's interesting if I can just add that you said that there was a time for personally when I was just waiting, when will this be over? And I could see that my personal anxiety was just raising. And then I came to acceptance. And that really helped, accepting what we have going on, accepting the new reality, and knowing that other people are in the same boat and are there with you. That changed things for me personally.
Yeah, and I think your experience is being mirrored throughout the state, even in all walks of life. Jackie, in terms of the people that you interact with, is there, you know, what do you sense is the that the thing, if there was a common element that many of the clients that you work with are looking to as like the light at the end of a tunnel as a result of COVID? Is there is it just summer weather? Is it the moment they can return to in-person services? Is it, what do you have a sense of what that beginning of a turning point is in that collective clientele? I'm trying to stump you, so I've
It's
tried to.
stumping me, yeah, because I think what Mona is saying, I agree. I mean, we're living in the gray, and the most disconcerting thing is the unknown, and there's no way to tangibly or even in your head know what it's going to look like in our future. But yeah, I mean, I do we want everything to go back to what it was? I'm not sure if that would be what we want, but we want something new, and if something new happens, we want it to be better. But how will we know? I don't know. So I can't answer that. I'm sorry.
Well, no, it's an unfair position to put you in because it's the question I think we're all asking, but because you guys professionally do this work, I thought I would try and steal some insights from you. Well, I want to thank all three of you for sharing your universe with us tonight, because as I always try to articulate, usually not very well, when we think about people's well-being, physical health, hospitals, clinics, that's what we think of first, just because it's been sort of pounded into our minds over the years and all the images. And most of the TV dramas are about hospitals, not mental health clinics. And so, but people I think are quick to appreciate once you confront that reality and say that mental health really is on par with physical health in terms of someone's well-being. And so, as I say, your work is almost always taken for granted. And when you're doing a superlative job, that's precisely when no one notices it. But that doesn't mean it's any less critical. So thank you for the work you do. And I hope you hang in there and stay resilient in these very weird days that we've got. So thank you all.
Thank you, Tim.
Thank
Thank
you.
you. And I'm happy to say we had no COVID cases amongst our clients.
All right. Well, I'm going to chalk that up to good work, not luck.
Yeah.
With that, why don't we sign off, and I'll see everybody next time. Thanks and stay safe.
Thank you.
Thank you so much.